Dear colleagues, at first I'd like Professor Fakri for inviting me, and it's a pity that I couldn't come in person, but so we will do it in video and I will be online during the presentation. Thank you so much. So I will talk about self-wrapping after therapeutic lymphedema drainage. This is my disclosure. Lymphedema is a chronic disease requiring treatment. This is from the consensus document from the International Society of Lymphology in 2020. It occurs at any age in childhood. Most primary types of lymphedema dominate, and the secondary ones dominate in growing age. But with adequate therapy, which includes conservative and surgical procedures, progression can be prevented. But there is insufficient evidence to suggest important differences between standard care and conservative treatment strategies for reducing lymphedema volume and improving lymphedema-related symptoms. Those are our patients. So you see, due to obesity, more and more patients are coming with secondary lymphedema because the lymph transport capacity is going down due to massive obesity. For example, here you see a very obese patient with 220 kilograms and a scrotum of 60 kilograms. Here you have a secondary lymphedema, another secondary lymphedema. Of course, lymphedema can appear at any part of the body, for example, face lymphedema after tongue cancer. This is a primary lymphedema. So he started with the age of 9 and growing, the edema went up and he even developed a severe genital edema. Another lymphedema after uterus cancer, next cervix cancer, obesity. You have a patient with filariasis, secondary lymphedema and primary lymphedema. The therapy of peripheral lymphedema is divided into conservative, non-operative and operative methods in the document of the ISL from 2020. In the first phase, it consists of skin care, a specific light manual massage, we call it manual lymphatic drainage, MLD, and sometimes deeper techniques with patients classified above stage 1 using muscle pumping exercises and compression typically applied with multi-layer bandage wrapping. In the German guideline from 2017, and they will be new at the end of this year, so we make a difference of phase 1, this is a phase of reduction, and phase 2, phase of optimizing and conservation of the reached result. So in phase 1 we do daily manual lymphatic drainage, then of course in care to prevent injuries and prevent dermatolymphangiodenitis. Then in the phase of reduction we have to go on with bandaging, because when the edema is reduced the bandage will slip down, so there is no use for compression stockings in phase 1. Exercises, and we have to educate the patient in self-management, how he can start by himself and how he can do the bandage. Phase 2, MLD if it's necessary, skin care, and in most cases MTM, flat knitted stockings, exercises, and of course self-management. Now coming to MLD. MLD is a technique and it depends on the tissue. If the tissue is very hard, we need very hard and deep techniques. If we have a soft edema, we need more superficial techniques, staying circles to activate the lymphatics and so on. It's a special technique called manual lymphatic drainage. After manual lymphatic drainage, so we go on with skin care. In skin care, there is a paper from 2013, Best Practice in Skin Care Management in Lymphedema. It is important for assessment and observation of the skin because due to treatment, especially after bandaging with some padding inside, so you may have some irritations of the skin. Otherwise, so it will develop and dermatolymphadenitis. In former time it was called cellulitis, but now from Olszewski he told us it's better to say DLA, that means dermatolymphadenitis, so that we know that the whole lymphatic system is involved to reduce the inflammation. So we have to clean the skin. Then the moisturing is very important. It's crucial and indispensable. With moisture, soap substitutes and bath salts. We have to conserve water within the skin. Then have a look at fungal infections and bacterial infections. And when you have some wounds in lymphedema patients, we have to go on with debridement and wound bed preparation. Coming to compression. So you see just papyrus from old ancient Egyptian times. So you were used to bandage the whole body. And we have to go on and educate our patients what they can do by themselves. The paper from Hugo Patch and Stanley Roxon from 2018, Compression Therapy, explains that compression therapy is a cornerstone of conservative therapy in lymphedema patients. Thereafter, lifelong sustained compression is essential in order to maintain the edema reduction. Usually, compression hosiery is prescribed, which facilitates self-management. Adjustable Velcro devices are often easier to handle and can be a good alternative even for the initial therapy phase, and the patient can readjust them by himself. And in addition, we use intermittent pneumatic compression. This has been employed in the medical approach to vascular diseases for more than 80 years and may be used as a supporting regime, both in the initial treatment phase and in the maintenance phase, in addition to an established management with sustained compression. Self-care. Self-care is very important, but it is limited by the patient's compliance, which will improve by counseling the patient and especially through positive experiences related to the beneficial impact of proper compression treatment. The indications for compression therapy in venous and lymphatic disease consensus based on an experimental data and scientific evidence from the International Union of Phlebology. High levels of compression, 30 to 40 millimeter of mercury, are effective in the management of lymphedema. So this is what pressure we have to use. But when you have more stiff tissue and fibrotic stiff tissue, so you can use more compression. And when the tissue is really completely hard, so we even use pressure up to nearly 100 millimeter of mercury. We have different types of bandages, so long stretch, short stretch. Then we have the Unabut and adjustable Velcro devices. Classification of compression bandages, there's a practical aspect from Hugo Patch and Giovanni Mosti, and it tells compression bandages appear to be simple medical devices. However, there's a lack of agreement over their classification and confusion for the use of important terms such as elastic, inelastic, and stiffness. Influence of different materials in multi-component bandages on pressure and stiffness of the final bandage from Giovanni Mosti and Hugo Patch, 2008. And Mieke Floor told us in 2008, Creative compression treatment in challenging situations. The use of compression materials must be planned. Indications and contraindications exist for elastic and non-elastic materials and techniques. There will always be situations where either standard or optimal treatment cannot be applied and where clinicians must be creative in the treatment they offer. The kinds of compression bandages, stockings, and adjustable Velcro wraps. Long stretch, that means elastic bandages. They are used in places where we don't have any muscle that can work against the bandage. So the long stretch bandage has a high resting pressure and a low working pressure due to the stretchability, and it stretched more than 100% of the initial original length. Most commonly, long stretch bandages are used to treat sprained areas of the body. They are often used to provide support and relief to tendons, ligaments, and muscles. So we use it mostly in abdomen lymphedema, thoracical lymphedema, breast lymphedema, and in genital edema. The short stretch inelastic bandage on the upper picture, you see what we use for one leg. We call it multi-component multi-layer bandage. The short stretch bandage, however, are composed of cotton fibers. The main advantage of the short stretch bandage is that they provide high working pressure and very low resting pressure. And it's necessary for lymphatic drainage as well as venous flow, because the muscle cannot shift the bandage away, so muscle has to work inside, and there it compresses the deep venous and lymphatic system. The advantage of those bandages, they are reusable and easily washable. They end up being quite economical for people suffering from venous edema, lymphedema, post-traumatic swelling, and so on. Another stiffest material what we have is the Unabut, because it's totally inelastic. They are from polyamide, sometimes gauze, impregnated with zinc oxide and calamine, and it sticks on the skin. It does a very good reduction due to the stiffness, but will be loosened after a few hours by edema reduction. And the disadvantage, it's only one-time use. So when you have very, very severe and hard fibrotic tissue, we use Unabut, but after 2 days you have to throw them away because the edema is reduced, and so there is no pressure anymore. Several studies have shown an impressive reduction in swelling as a result of compression, and inelastic bandages have become widely accepted as a part of lymphatic decongestive therapy for managing lymphedema. It is shown that completely rigid material like zinc paste applied without padding provides a good level of efficacy. Coming back to the International Society of Lymphology, there are a lot of different possibilities, but in most countries there is no possibility for the patient to get MLD, manual lymphatic drainage. So patient is living far away from the next doctor, so you have to educate the patient in self-management. This is a main important thing, self-management in bandaging, in compression. But I think that a lot of you see those results after self-management of patients. So even good educated patients, they know that the bandage will slip down after a few hours due to edema reduction, but they don't want to take it off again and apply it again because it takes sometimes several hours. So that was a reason why there was a developing of adjustable Velcro wraps, AVY. The main advantage of these devices are The Velcro strips are the only inelastic material which can be handled by the patients or by untrained staff. The pressure loss can be readjusted by the patients according to subjective sensations. So there are Velcro strips or some hooks where you can just open it and tow it again so that you always have the same pressure. And here you see one patient the pictures down. So that was the beginning. His right leg had a severe lymphedema of stage 3, and he was able to use those adjustable Velcro devices, and it took only 2 months to reduce 25 liters. On the sidebar you see another patient. This is a left leg he is suffering from, and the adjustable Velcro device on the leg by itself. We started in 2013 with the first adjustable Velcro device. There was a woman suffering from dependency lymphedema due to her heavy overweight. Her weight was 320 kilograms, the age 48 years. So second picture from the left, you see the bandage. So just when she started to move a bit in the bed, the whole bandage slipped down. So that was the reason I called the company and said, I need some made-to-measure adjustable devices, and then we started with adjustable Velcro wraps, and you see the result on the right leg after 3 months. Patient was at that time able to walk by herself. When she arrived, she was only lying in bed. In summary, an adjustable Velcro compression bandage as part of complex physical decongestion can significantly reduce volume similar to conventional multi-layer bandages and improve quality of life. It can be a comfortable alternative to conventional multi-layer bandages in the active treatment phase of complex decongestive treatment. So, adjustable Velcro bandage for chronic edema reduction. The garments are made of short stretch fabrics. They have a high rigidity index. They are wrapped around the leg, foot, and the whole leg, adapt to the shape of the limb, and adjusted according to the desired pressure. And they are fixed with Velcro type closures. There are some papers that showed that the effectiveness of adjustable Velcro wraps versus inelastic multi-component compression bandages in the initial treatment of leg lymphedema, they are more effective than the inelastic bandages, and adjustable Velcro compression devices are more effective. So this is how to prepare in the phase of decongestion. So we stick several parts together so that we can have a circumference up to 2 meters and even more. When the circumference is reduced, so then we can shorten the bandage and make it step by step adjustable by us, and adjustable for the patient due to the Velcro straps. I will show you just in a short movie how we do it on very, very severe lymphedema. So this is one of the patients. So we need 2 nurses, or we have here 3 nurses, and one is keeping the leg and just to protect some the skin parts. And then we pull it together, and you see when we recognize that it's too loose, so then we stick it more narrow, like here you see it, they take it off and put it again to another place, and now we tore it together, and so we have a very, very good and hard compression on the legs. Now I will show you some results. This, for example, in 2 months, 29 liters less. And you see those are different patients, but they are coming from the same country. They are coming from Algeria, and they don't have any possibility to get another treatment. So we educate them to use the readjustable Velcro devices. That was the beginning when the patient arrived, and that was the end, beginning and the end. Patient lost in 2 months 29 liters out of the left leg, and this patient was suffering from lymphedema of the right leg, and here you see using the straps by himself, and that was a reduction 25 liters less. Of course, we can use it even in very severe genital edema. The patient was able to put on the bandage by himself, then going to the toilet and take it off and put it on again. So it's much easier than compression bandage that always will slip down when the patient is moving. After bandaging, after MLD, so then the patient have to go to exercises. After the patients are bandaged, so they have to go on with exercises to use the muscle pump to shift the liquid out of the legs. An alternative to compression bandage is aqua gym. When the patients are staying in water 1.20 m or 1.30 m deep, so the pressure in the ankle area is about 73 to 76 millimeter of mercury. So this is important, but after getting out of the water they have to dry, and then they have to wear their compression again as main cornerstone of treatment of lymphedema. Now I show you a patient that was a patient from Spain. The circumference of the calf was 1.58 m. That was a reduction after 6 months. So just wearing the compression trousers, and there was no surgery. And then we provided her with the adjustable Velcro device, and she was so happy because for a phase of maintenance, she was wearing the stockings during daytime, and she was applying the bandage every evening for nighttime. And it took her nearly 45 minutes to cover both legs with multi-layer bandage. And now with the adjustable Velcro device, it took only 15 minutes to cover both legs totally. In conclusion, compression therapy and movement is the most important column of the treatment. Velcro devices are useful in phase 1 for reduction and phase 2 for optimizing, and especially for self-management. In a lot of countries, the patients are not supported by therapists and by the doctors. They have a long way to find the doctor who is involved in lymphedema treatment. So they have to learn it, and they have to be educated by the doctor in self-management. Thank you so much for attention, and Professor Farkas, thank you so much for inviting me, and have a good conference.